Hi, I'm Eric Cooper, and I'm made for more personal hiking time.
Welcome back to the Made for More podcast. Today's guest is Eric Cooper, Director of Cardiovascular Services at Adventist Health and Rideout. Our discussion with Eric today centers around the journey that the cardiology department has been on over the last few years at the hospital, as well as his own personal journey in healthcare. It's a fantastic discussion. We hope you enjoy it. Without further ado, please enjoy this discussion, this episode with Eric Cooper, Director of Cardiovascular Services. Well, Eric, thanks so much for being here today. I really appreciate getting a few minutes to talk to you. Wanted to ask first off, how are you? I know it's a busy time of year. It kind of feels like all times of the year are busy times, but how are things going?
I'm doing well, and thank you for having me here. I really appreciate it.
Yeah, definitely. So, today I want to have, a really in-depth conversation about the cardiology department and all of the great things that are happening within that department. I think where we first should start, though, is talking a little bit about you and your background in healthcare and your background in general. Can you tell me a little bit about maybe where you grew up, what inspired you to get into healthcare? Maybe we can start there.
Sure. So I'm a Bay Area native. I grew up in San Lorenzo, and eventually Union City. So after graduating from high school, I went to local colleges, was Cal State Hayward, now Cal State East Bay. Got interested in the medical field. I was doing physical therapy, just kind of bouncing around. And I was running track, and my track coach said, "Hey, what are you going to do?" And I said, "Well, I'm in health sciences." And he's like, "Okay, well, what are you going to do?" And I said, "Well, what are the options?" So physical therapist, doctor, those traditional things. And then he said, "Well, my wife's a nurse, and she works 3 days a week." Caught my attention, and he said, "You work really hard on the days that you are here, so maybe you want to check her out and see if it's up for you." And so, I went, and it kind of appealed to me, the independence, the science, the nursing science, a different approach, where you didn't have to be a doctor, but you were also an advocate. You're basically there advocating for a patient when the doctor's at home. And so I started to really do some rounds with this individual. She was really gracious and took me to her place, and I was able to see emergency room nursing, nurse anesthetist, cardiology, and I ended up getting into the nursing program. And after that, I ended up practicing at Stanford for about 20 years. Oh, wow. And while I was there, everything from critical care to PACU recovery, OR recovery, cardiology always stood out. It was one of those things where it just kind of drew me to that space. While I was there, I also was a research fellow. So I was an evidence-based practice research fellow at Stanford and UCSF. And while I was doing that fellowship, my cousin was about 9 months older than me, became ill in another state, and I tried to get him into a clinical trial for cardiology. He had cardiomyopathy. His heart had enlarged from having a virus. He was an athlete, and like us guys do, we just want to power through and keep working, and that's what he did, and his heart enlarged. Unfortunately, he actually was in the hospital and calling on his call light, and the nurses didn't respond. And so he ended up having a heart attack and passing away. It affected me so much that I decided that I wanted to go back and get my master's and try to contribute in a way. When you're at the bedside, it's great. Yeah. I was at the bedside for 20 years, but you affect that one or two people that you have per shift. Sure. But I felt like the way I could really make a contribution so that no one would have to go through that is that I dealt with was to try to get into the administrative space and put my talents towards that effort. And so I ended up going back and getting my master's in public administration, healthcare administration down at USC. And immediately after graduating, UCLA offered me a job. So I actually left Stanford and went to UCLA. And so I was able to be at two of the best institutions in California, if not the nation, and learn about processes, the way they do things, and see it firsthand. Cardiology was tugging on me, and I decided after a couple of years that I would need to figure out if I was going to stay in interventional radiology or stay in cardiology. And, a series of events that I guess we'll talk about later kind of led me to come back to Northern California. and try to apply some of those skills that I learned over the years. And so that's kind of been my journey as I got here to Adventist and Rideout.
Yeah, that's such a fascinating journey. I mean, like you said, two of the best hospitals in the state, if not the country, and getting, getting to learn from those institutions and really shaping probably your career in healthcare. That's very powerful stuff. I gotta jump back just really quickly.
Yeah.
You mentioned track and field. I know it doesn't look like it now, but once upon a time I was doing track as well, running distance. What events were you doing?
Well, I was 800-meter runner during track season and in cross country off track season.
Oh, so, nice. Yeah, same boat. 400,
800, 15, and 4x4 relay every single track meet. So, I was fried by the end of couldn't go out Saturday night. So it kept me out of trouble. I kind of ran, slept, worked out, study, repeat.
Yeah.
So, that was my event. So I was best at the 800. So, I really enjoyed that. Still run now, but now it's more for interest rates rather than titles.
Sure. Yeah. Fun stuff, great memories from those years.
Definitely.
And you touched on it just a second ago about kind of what inspired you to come back north and join Adventist Health and Rideout. And I wanted to ask you a little bit about that because I know there's a multitude of factors that kind of played into things. Can you talk about the decision to come to Marysville?
Yeah, it was multifactorial. On the business side, I had some mutual friends to the then CEO that was here, Gino, and they had said, hey, there's this facility in a rural place that doesn't have a STEMI program. People are dying on the way to Sacramento. They need some help. And I kind of, your name came up, and I kind of thought that you might be interested in, helping that system to get their STEMI program back with the help of the execs and the physicians. Are you interested, And it was just on the back burner. My wife is from Walnut Creek, Livermore area. After, so many years, we moved to LA, and she was kind of missing the Bay Area.
Sure.
So, and our relatives are all up here.
Yeah.
So it was kind of on the table, but not really seriously thinking about it. And at the time that I was approached, I was coaching my daughter's basketball team. She was about 14 or 15 at the time, and she collapsed middle of the court with no warning. And so I immediately thought cardiac event, so go running over, she's not responsive. And then she came back around, and, it was really bizarre. And so, I kind of had said, well, we'll figure this out. We're at the best places. We took her to lots of hospitals down south, and no one could figure out what was going on. And so, there were times where you kind of figure, should I be here down in Los Angeles, or should I go back north and try to leverage all of the contacts I've made for 20 years, all the people, doctors. And so we started reaching back out to UCSF and Stanford, and making trips back and forth every other week was really exhausting.
Yeah.
And so, at one point I might have said a prayer, something to the lines of, Lord, I'll do whatever I need to do to, get my daughter well.
Yeah.
And if you're not serious, don't make that prayer. That's my suggestions. Because ironically, doors started closing.
Yeah.
Things where we were living, they weren't working out. Every time we bid on the house, we were getting outbid. The job that I was at was starting to ask for different things that were not originally discussed in our contract.
Sure.
And then the call for a Rideout kept coming, and I kept saying, no, I'm not ready. I'm not ready. And then it seems like when every single thing, I was up here on business for a different system. And I had went there, and as I was leaving, I got one call, and they said, "Hey, if you're in the area, can you please come by?" And I said, "Sure, why not?"
Yeah.
And I came here, and I started listening to the story about the patients, the population, and it really was, I can tell you, it really was hitting home and giving me memories. There was people that were vulnerable, on the fringes, not close enough to the resources that they needed, and there was no good reason why this place couldn't have the same resources as a Sacramento or Stanford or anywhere else.
Sure.
Because at the end of the day, you can make excellence anywhere, and I firmly believe that. And so it was tugging at me. Hey, you went to all these places, you've done all these things. This is the time where you need help. Maybe you should help. Maybe you should, even if you did it for a year, or
Right.
maybe you did it for a couple years. And so I was on my way back. I came and visited, was on my way back home with my wife, and my wife was like, well, maybe I'll go next week because I have to bring her daughter. Her name's Amani. We have to bring her back up next week. And I was like, oh, this is getting exhausting. And so finally we made the decision to come up here.
Yeah.
The interesting thing is after multiple times of saying no, we finally said yes. One of the physicians had taken me to lunch, and he was asking him how my family was. And I kind of said, hey, my daughter's not doing that well. She's got some kind of immune disorder. No one can figure it out. I don't know. We're working with UCSF now. We're working with other people. And it's just really just sucks the life out of you.
Yeah.
And he kind of listened to me, and then he started to say, well, I have a friend that I used to play with in my childhood days in Iran, and let me give him a call. And it was about 10 o'clock our time.
Right.
And so he called back east. It had to be almost 1 o'clock back east. The person answered the phone. He explained what was going on, and then he handed me the phone. And that was probably a moment I'll never forget, because in that moment, this physician, his name is Khosrow Farhad, Dr. Farhad, he said, oh, I know exactly what's going on, and this is the protocol you need to do, and give me the name of your doctor, and I'll send him my protocol. I've had 10 patients with the exact same thing. Your daughter can be the 11th, and 10 out of 10 are back to the normal life. And I couldn't believe what I was hearing, And I thought, of all the hospitals I could have went to, of all of the places I could have met, doctors I've met, what were the statistical odds
Right.
of going to a hospital where a physician was friends with another physician halfway across the country doing a trial with less than 10 people in it on the same thing that my daughter had
Yeah.
been diagnosed with.
Yeah.
So, that was overpowering for us. And then at that moment, I felt that, it was my duty to try to bless as many people as I could with my talents and be used through God to bring better things to come about, since I had received a blessing, in my family. So it was a very pivotal moment in our life. And so I can say now my daughter is doing well. She's healthy. She's been healthy for several years now. I'm getting ready to graduate this year and from college. So, praise God for that.
It is such an incredible story. And we talked about this off camera. Just, it really feels like an occurrence of fate to have the things align in the way that they did to get your daughter the care that she needed. I mean, that is really, really powerful stuff. Well, Eric, thank you for sharing that. That was really incredible to hear. I wanted to ask you about when you got to the hospital. I wanted to ask you about maybe the state of cardiology services when you arrived, and kind of what you saw as your vision for where the cardiology department could go upon your arrival. And what year was this?
This was 2017.
Okay.
I saw a lot of opportunity. I saw people that had good intentions, but when you have unpredictable or variable inputs to any system, you're going to have unpredictable outputs.
Yeah.
And so you might have a case that went great. You might have one that didn't go so great. And you could never narrow down what was the driver behind that. And so I saw a lot of opportunity. I saw a lot of people that had passion, a lot of people from the community that know patients personally, and they were committed. And so, I say that you can't have everything, right? You have to have the 2 of 3.
Yeah.
Are you going to have a prestige? Or are you going to have the money, the glory, whatever? But at the end of the day, I would take people that are passionate and that believe in the same mission as I do, and you can work with that group of people. And so when I got here, that was one of the things that impressed me the most, is the dedication of the doctors and the staff and the nurses and the techs. And I felt that with that kind of buy-in, I only needed 1 or 2 disciples, so to speak, to believe in the message of, hey, we can be a mini academic place here if we apply those same principles. I only needed a couple of people to really buy into that, and I knew it would be infectious and kind of blossom into what it is right now. And I think that was a vision that I had back then. And there were days where I went home and was like, okay, are you realistic? Is this something that you can really do?
Yeah.
There's lots of doubts. Sometimes you have imposter syndrome and say, what am I doing? How can I do this?
Yeah.
How can you do it? And the answer is you can't do it. It has to be a group effort, and it has to be everybody in alignment, from executives to physicians to staff to resources to finances, all agreeing that this is what we want to do. And I had that message given to me soundly back then. And I think that was an important driver in getting to the status and the level that we are today.
Yeah, absolutely. Were there certain milestones that you had kind of set out for the department, or goals that you wanted to hit to maybe continue progressing to a place where you wanted to see it, I guess, a place you wanted to see it get to?
Yes. So we had a 5-year plan.
Okay.
And it was all hinging on developing the Adventist Heart and Vascular Institute in conjunction with St. Helena.
Yeah.
So initially we had meetings where those executives and staff would come over and we'd have like a joint meeting. This was pre-COVID. And we would discuss what we all wanted to do as far as service lines, achievements, accreditations, third-party validation, that sort of thing. And so one of the first milestones was just forming that body, that governing body. Once that was formed, we kind of started to say, okay, well, what do we want to do the first year? So I looked long-term to say, ultimately, we have this new certification coming out from the American College of Cardiology, which was HeartCARE. At the time, it was going to be new. Not a lot of facilities have it here on the West. It's huge on the East Coast. So we were kind of like early adopters, and I was pitching this, if we should really get this validation from the American College of Cardiology, because it will align us with some of the best hospital practices in the nation. And to do that, the first milestone was achieving cath lab accreditation. So that was our very first accreditation. Our quality analysts worked very hard with that. We were visited by surveyors that came to our institution, took a look at our processes, took a look at our outcomes, and some things we were given a little report card. You need to improve on this by the next time we come, and so we had some homework to do. But that was the first milestone in getting our staff some momentum to see that, listen, we want to apply ourselves to this. Look what we were able to do with the physicians' help. Look what we were able to do on a shared leadership level. We also then partnered with the American Heart Association to do get with the guidelines. And the get with the guidelines, our chest pain right now program is, I believe it's platinum.
Yeah.
And so, that started as bronze or whatever it was, the lowest level, and just year after year saying, okay, we're going to be bronze. We celebrated the bronze. We celebrated it along the way. We celebrated the silver. And then we missed a few, one quarter, we dropped back to bronze. And it was a wake-up call that say we have to continue to do the things the little things that make you successful every single day and every single encounter. And now we're at platinum, which means we haven't missed that for several years now.
Yeah.
The next milestone that came was chest pain accreditation. I'm going to back up, though. Before the actual Heart and Vascular Institute, what was most important was getting the STEMI program back in this community.
Yeah.
So we worked with the Sacramento Sierra Valley, SSV, EMS agency to determine how can we get this program back as a STEMI receiving center. What that means is California designates centers as either referral center or receiving center. So in the Sacramento Valley, we have Inlow, Oroville, we have also Kaiser is in there, Sutter, and Dignity. And you get benchmark, and also hospital all the way up north in Redding.
Sure. Yeah.
So you get benchmark, and so they can see how are you doing against your peers, and the actually ambulance traffic will bypass you if you're not a STEMI center.
Oh, interesting.
So when you are a STEMI center, that means that they're going to go to the nearest. If someone has a heart attack way out in wherever it is, they're going to go to the nearest location, because time is heart muscle, time is brain.
Right.
We want to get people to those areas quickly.
Right.
And so not having that designation meant there was no mandate for that company to go there. They would bypass and try to make it to Sacramento.
Yeah.
Or they would try to go the other way and go to Enloe. And so people were not making it. I'll tell you honestly, you can't make it. If you have chest pain, you need to get to the nearest center immediately.
As soon as possible, yeah.
As soon as possible. And so by opening that, we hired a couple of interventionalists at the time to help with our call coverage. And the doctors here, they all pulled together, and we were able to successfully enter back into that status. And we've been in a receiving center since that time. And we do very well in the region. Our times are comparable to all the times in Sacramento. Some are better.
Yeah.
Some are at the median, but we're doing very well with that kind of benchmarking. So that was that major milestone. And then after that, 2 more accreditations came. The chest pain accreditation was a milestone, which basically said that now that we had our STEMI certification, we were performing in the top quartile, top decile of all hospitals our size across the nation in that particular modality. So if it takes an average of 60 minutes across the nation for a patient to have an arrival to the cath lab, we were right there with the best institutions. And so that accreditation came. And then the next milestone after that was the EP program, where Dr. R.P. Singh was brought in.
Yeah.
He started to do, programs like our EP and Watchman Structural Heart Program, offering that to the community. I partnered with him and my team, and we then received EP accreditation. So we have national accreditations in 3 of those services.
Yeah.
And that is the milestone that led to our HeartCARE certification. So we've been HeartCARE for, I think, 5 years running now. And it's a great thing to show the progress and the hard work of all the people involved, and those milestones are important. So that's kind of where we are now.
Yeah. You mentioned earlier the idea of having a few disciples that could kind of align with the mission and help you move forward. And I think these kinds of milestones help you show the evidence that the work we're putting in is being validated. It's paying off in the kinds of care, the level of care that you're able to provide. And it's probably gaining you a few more disciples along the way too. I mean, people buy in when you can see that the hard work is making a difference.
You're 100% correct. We don't have a lot of turnover. Some places will say, I could go to Sacramento, make more money and do this. But we have a dedicated core of people that have been here since day one, and they've seen all the changes and been through the ups and the downs and remained here, and they're happy to be here. So that's also something I'm very proud of.
Yeah, absolutely. You mentioned the 5-year plan that you had when you got here. I want to ask you, concurrently as you're moving through this plan and making these changes, making these improvements as a department, you're also getting used to a new community. Living here, and we talked off camera about it is quite a change to go from Southern California, Malibu, and all of that up to Marysville. And I want to ask you about what the reception has been like in the community, what it's been like becoming a part of this community for you, and how it's been, kind of settling in here.
So I'm here a lot. We actually moved a little closer, so my wife's at another hospital system, so we had to do a midpoint. So I didn't win to move all the way to Yuba-Sutter. But, I spent an awful lot of time here and spend time in the community, through our different initiatives and working with people. And overwhelmingly, I used to run down the downtown in my lunch break in Los Angeles. And you could smell the ocean and all that kind of stuff. But, I'll tell you honestly, I feel safer running down the street here because everybody kind of keeps to themselves. It's been a nice change. I mean, growing up, I grew up in the Bay Area when it was gladiola fields everywhere. And it was a lot like this area. That you kind of always glorify that when you're getting older. Like, it was so great. We could ride our bikes for miles through the fields. And that's kind of one of the things I like about here. It's still not overbuilt. And it's a small town community that still cares about other people, I feel. So that's kind of what I like about it.
Yeah, absolutely. And it really does feel like, you know, the struggles that the hospital has had historically aside, it feels like, at least in the time that I've been here, that the community is rooting for the hospital. They have a vested interest in the hospital being the best that it can be.
Yeah.
Everyone that I seem to talk to has that same kind of mentality. They want the hospital to be great.
Yeah.
And I think, especially in these last few years, we're living up to that end of the bargain in a lot of ways. I wanted to ask you a little bit about that, about what these milestones, what these achievements, these recognitions kind of mean to the community. What does having this kind of access to care mean for the people that we care for? What do you think? I guess, what do you think the community should know about the level of care that's being provided at this point in time?
The level of care and the outcomes that we're achieving in our interventional cardiology, diagnostic cardiology, that's going to be on par with some of the best hospitals in the state and best hospitals across the nation, because our outcomes and our, you want to say, the things that don't go well, you know, those are all benchmarked. And in a lot of things, we are in the top decile. I'll talk a little bit about how this is measured. It's very, very stringent, right? So when I first got here, one of the first things I wanted to understand is, what is our baseline? Where are we at? You know, I was seeing all these things on Facebook, all the jokes and all of the little nicknames about going to Rideout. Yeah. And I was a little confused because, you know, I've had read that it was the biggest employer in the region, and you would think that people wanted to not go away, you know, but there was a lot of negative talk, and it was not something you could ignore, you know? So I said, okay, well, if this is the perception, is it reality? And so one of the metrics that we really zoned in on was this metric that measures from the time a person comes into the hospital with the chest pain or some sort of cardiac diagnosis, and until the time they receive cardiac rehab. How do we do? So it's called defect-free care, and it's through our chest pain registry, and it has 11 specific things that say this is the minimum you should be doing for a patient that has this diagnosis. So when I arrived, that number was about 13%. So that meant that, you know, 87% of the time, one of those 11 things that must be done wasn't getting done. Yeah. And so speaking with the physicians and speaking with, you know, the team, we all agreed that was not acceptable. Yeah. Part of it was a knowledge deficit. People didn't know what needed to be done. Yeah. Some people didn't even know the metrics existed. They didn't know that, hey, if I didn't tell them to take the aspirin, that, you know, it would count against us. But, you know, they had an abdominal bleed a couple of weeks ago, so I didn't give them the aspirin. So, you know, the way that we had to educate the physicians to say, document so that we are reflective of any exception so it doesn't count against us. That was a huge move forward, because over the years, that was how we kind of judged, or I judged how well we were doing. Yeah. I checked before I came, and we're currently as a rolling 4 quarters. So for the last 4 quarters average, we're 95.4. Wow. So of course, that's a great number. Yeah. I'd love to see it at 100. But to be able to say that you were doing something at 13% 6-7 years ago, and now you're at almost 96% efficiency, speaks to the level of dedication that this team has to the community. And that's what the community should know, that you are going to receive excellent cardiac care coming through. You're going to not get any advantage by trying to go, you know, if you have chest pain, there is no advantage trying to get to another hospital. And I know that our metrics will stand up because they're against the entire database across the United States. It's not just in this area. So we're in that top 10% of all hospitals our size in the United States, which is really good company. Yeah. You know.
Yeah, that's I mean, astounding. I'm kind of blown away by that kind of data. Being able to make that kind of improvement in that amount of time is nothing short of incredible. Yet, like you said, it speaks to the dedication, and it speaks to how invested the team is in providing great care. I wanted to ask you about kind of reflecting on this time so far. I know you're not done. I know you have a vision of where you want to continue to take this department and the services provided here. But I want to ask you about maybe what you're most proud of in terms of what you've been able to do and what this team has been able to do.
I think I'm most proud of, I kind of alluded to it before, the dedication and, the amount of effort that's put into wanting to change. That's huge when you're trying to put an initiative in place. But I think that I am proud of the fact that we were able to work together with the people we had, with the resources we had, and put mechanisms in place to use the people that were here in the community, and not say, hire a whole bunch of people to come in that, are just going to stay here and take off. But not only were we able to have those people be dedicated to the training, the physicians to be dedicated to the changes we were making, everyone was committed to the goals that we put forward. And I'm proud of the fact that we were able to actually achieve those goals, because they were really lofty.
Yeah.
And maintaining those goals is even a bigger challenge. And so now that we have been able to maintain that level of excellence, I'm really proud of all the work that everybody has done. But that translates to the metrics, the work, putting in the right mechanisms, the systems, and then having that translate into a palpable change that impacts the community, so that now, going to Sacramento is not any different than going here. Maybe a worse experience. They're not accredited. Some places are not accredited that you may go to. So I think the pride comes from being able to leverage the resources that are in this community and achieve the same level of excellence of any hospital that you would you'd think of. Wow, that place is doing great. That's the way the reception I get from a lot of people in Sacramento. Like I had alluded to, my wife is at another system, and there's competition there, and they might say, "Oh, well, we're this and they're this," and my wife kind of says, "Oh, by the way, they are actually ahead of us." So, it should be a source of pride for the people on this team, the physicians on this team, that we were able to do something that no other hospital has done, which has become the first HeartCARE Center, National Center of Excellence in California. That's what we achieved. I'm also proud of the achievement to be listed on U.S. News and World Reports, the efforts of this entire organization. We were ranked number 1 for the last couple of years, and now we're ranked number 2. So we got some work to do, So, but it's amazing to think that we are so aligned with the quality initiatives, which translates into better patient care, which translates into better outcomes for patients. To have a quote little hospital like Adventist Health and Rideout be in that kind of a prestigious publication is really humbling. Yeah,
absolutely. And I think about that. I think about, at the heart of it all, it really is about providing the best care possible. The achievements are great. The recognitions are gratifying, but it really comes down to what can we do to make sure we're providing the best care we possibly can. Mm-hmm. And if we're not providing that best care, what can we do to make sure we are? That's really, really inspiring stuff. I can't end this without talking about the parallels between the department and the hospital as a whole. It really feels like these last few years, especially with the newer executive team coming in with Chris sat in this chair a couple months ago and talked about wanting to be the best community hospital in the nation, and he doesn't say that half-heartedly. He means it. And I think the cardiology department has been such a significant part of all the work that's being done to make this a hospital that the community can be proud of, can count on for care, and really be what he's envisioning, the best community hospital in the nation. And it's got to be. It's got to mean a lot to you to not only see the progress that the department is making, but see the hospital altogether really taking these steps, especially as someone who's been here since 2017 when things were much different. It feels, walking through the halls of the hospital, it feels different. And I think that's very much due to the kinds of efforts that are being made by people like you, by people like the team in the cardiology department. I guess to sum up what I'm saying here is, what does it mean to you to kind of be a part of this movement that Rideout is currently kind of engaging in?
It's everything starts with leadership.
Yeah.
And if leadership doesn't give the right message or the right support, people they kind of lose interest, they lose momentum. And so the leadership team, the executive leadership, has been very clear that no one less than excellent is the effort that's expected. No one's going to put up with just showing up.
Yeah.
And I agree with that. I mean, whether I've been on a sports team, I didn't join a race to come in last. I didn't want to, just be there and get a uniform. And so I think everybody wants to be proud of the work that they do. I think everybody wants to be part of something that's bigger than them and strive to get better. That's the kind of effort I want to be a part of. And apathy has no place in healthcare. That person could be your mom, your dad, you. Everybody has equal value. And I think that whether they are in a large, well-known academic institution or small community hospital, everybody deserves that same level of expertise. And I think that we've done a great job with changing that whole losing team, bad news bears kind of moniker, and just says, hey, whatever happened before, can't apologize for it. Sorry you had to go through that. I say that to patients when I do rounds sometimes, and they'll say, oh, I was here in 95 and they did this to me. And I apologize for that, but I wasn't here. And what we want to do is we want to look forward to what we can be.
Yeah.
And I think that that's the critical piece that, it's important to remember where we were, but we've got our eyes on being bigger than we are now and better than we are now, expanding services. We've added a vascular physician, Dr. Hossein, as well. And so it's always, how can we do better than we did last time? And it's refreshing because no one wants to be a part of a losing effort.
Yeah.
It's not good for morale. So I think we're on the right pathway.
Yeah, absolutely. Eric, before I let you go, I did want to give you the opportunity. Is there anything new, up and coming, things that we might want to touch on regarding the department? I know we talked about it already, but I think one of the most recent recognitions is once again becoming a HeartCARE Center, as designated by the ACC. Anything else that you might want to touch on or talk about in terms of the department? Yeah,
so we are currently expanding. We have 3 rooms right now, and we are expanding to a brand new 4th room that's already under construction. So patients will be able to receive state-of-the-art imaging, the best equipment that's out there. We're going to be using Philips. We also are going to be doing that in every single room. So it's going to be year after year. As one room goes up, the other one will start construction. So very excited that these kind of capital investments are going to make an impact on the community where they will be, getting the best of the best. I mean, this equipment has just been released, so I'm really excited to see the difference. You can think of, 4K or 8K TV now, and just imagine walking into Costco 10 years ago, what that looks like. So that's kind of the excitement level of the physicians. Everybody's really happy that this project is underway, and hopefully it'll be done in the next 6 to 7 months.
That's exciting. Yeah. That's really exciting.
Yes, it is.
Awesome. Well, Eric, thank you so much. This has been a really incredible discussion. I appreciate your time. And thank you so much for being here.
Appreciate it. Thank you for having me. It's been a joy. Thank you.
Definitely. Thanks so much for watching this episode of the Made for More podcast. To listen and find out more, check out our podcast on YouTube, Spotify, or wherever you get your podcasts. You can also find out more about Adventist Health and Rideout at www.adventisthealth.org. Thank you.